welcome everyone. Good morning. I'm Mackenzie with First 5 Contra Costa, and we're excited to be sharing the new Contra Costa Early Childhood Systems Map, a tool designed to help visualize and strengthen our early childhood system. So just a few housekeeping items from me. We are recording today's webinar, and closed captions are enabled. If you use closed captions, there's a little icon at the bottom with a CC on it to say show captions. You can click on that. Closed captions should pop up. You can also select your language that way. We are, slides and recordings will be available to those who registered for the webinar, and captions will be available in multiple languages in that recording. Please submit any questions that you have for our moderators or panelists using the Q&A function in Zoom. So we're going to be doing a few things in this space today. We'll hear opening remarks from First 5 Contra Costa's Executive Director, Dr. Ruth Fernandez. Ruth will speak to our role at the county as well as our role in developing this tool, highlighting why we were so excited to be part of the system mapping work. We'll then hear from Jessica Tang at Start Early Consulting about our partnership in building this tool and their larger national initiative. I'll then provide a very quick overview of the tool itself on First 5 Contra Costa's website. And then the main attraction, Dr. Fernandez will moderate a panel with Contra Costa County Supervisor Chanel Scales-Preston of District 5 and Dr. Francine Jolton, former chair of the Department of Pediatrics for Contra Costa Health Services. We'll then close out with some Q&A from our audience, followed by some closing remarks from Dr. Fernandez. And with that, I'm going to turn it over to you, Ruth.
Thank you so much, Mackenzie. Good morning, everyone. I'm Ruth Fernandez, Executive Director with First 5 Contra Costa, and I'm very excited to be in company with everyone this morning. Thank you again for joining us for this webinar. Since our agency was established by passage of California Proposition 10, tobacco tax in 1998, we have been partnering with many communities and organizations to make sure our county's young children have what they need to thrive. First 5 Contra Costa works to ensure young children are healthy, ready to learn, and supported in safe, nurturing families and communities. For more than 2 decades, we have supported efforts to help children in our county reach their full potential by focusing on their most critical years of development, prenatal through age 5. At First 5, we organize our work in 3 focus areas: early care and education, early intervention, and strengthening families. And we are steadfast in our mission and approach our work guided by our core organizational values of diversity and inclusion, equity, cultural humility, and community partnerships. To drive lasting impact, we intentionally focus on children and families who are struggling the most to thrive and work on systems changes that will ultimately improve the living conditions of young children. Now, we do this work through advocacy and community engagement, research, capacity building, and connecting families and early childhood practitioners to the critical resources. Next slide. The Early Childhood System Map is a visual and strategic tool that illustrates the many systems and programs families with young children in our county rely on. We're really thrilled to unveil this tool to all of you today. It also highlights families and service providers' perspectives on strengths and opportunities across these supports. We created the system map to first turn data into insights. By analyzing what early childhood services exist, who uses them, and how they are organized, we can uncover patterns, barriers, gaps, and assets. Now, we're excited about this map because this product is not just about passive data viewing. Our hope is that the system map supports decision makers, funders, and frontline providers in aligning efforts, improving access, and driving equity. We know that early childhood landscape in our county and in our entire state, for that matter, is complex and dynamic. It spans across healthcare, education, family support, workforce development, child welfare, and public health, amongst other sectors. Creating this map is part of our broader effort at First Five Contra Costa to build a more coordinated, responsive, and family-centered ecosystem. Next slide. So, how did we get here? First Five Contra Costa worked collaboratively to create this tool. We convened an advisory group with local organizations and county departments, which was critical to the development of this tool. And it was even more, it will be more critical as we continue to use it and move forward with our sense making with the data the map contains. We also work with Start Early Consulting, a national consulting entity. They developed the system map template and are launching this type of tools for different communities across the United States. I will now turn it over to Jessica Tang, Assistant Director of Start Early Consulting, to share a little bit more about our collaboration effort. Jessica?
Thanks so much, Ruth. As a quick introduction for anyone not familiar with Start Early, we are a national nonprofit headquartered in Chicago. For over 40 years, we have championed early learning and care prenatally through a child's earliest years. While we directly operate programs in Illinois and Washington State, my team, Start Early Consulting, partners with public sector leaders and advocates throughout the country, like First Five Contra Costa, to build resilient early childhood systems. If we could go to the next slide. Over the years, we've created the Early Childhood Systems Map, and in 2024 and 2025, we piloted this tool with 5 communities across the nation, including Contra Costa. We designed the systems map to support systems leaders to identify strengths and challenges, make data-informed decisions, assist resourcing and collective investment conversations, and at the very core, improve coordination across the system for better outcomes for children and families. Fundamentally, the systems map is created based on what we find, hear, and see in the community. We build each systems map based on information collected from focus groups and interviews with families and providers, conversations with partners, and local and national quantitative data sets. Our findings are also validated with the community partners to ensure that the story the systems map tells is representative of your day-to-day experience. These are the steps we took in Contra Costa as well, and a key learning that really came out of this work for Start Early was the importance of partnerships and coordination across the system. First Five's relationships across the county were foundational to the data collection and creation of the map, but now are really important in the aftermath too, as First Five brings partners together to create shared understanding, advance conversations, and support that decision making. What motivated Start Early from the beginning to partner with First Five was the fact that they came into the process with a clear understanding of how the end product would fit into their system-wide coordination and strategic planning efforts, and how they brought many critical partners along throughout the process through the advisory group, as Ruth shared earlier. Having these relationships has really taught us about some of the enabling conditions that are essential to the process of creating and using an early childhood systems map, and we're really excited to see what's ahead for Contra Costa. And I think I'll turn it over to Mackenzie to share a little bit more about the actual systems map.
Great. Thank you so much, Jess, for that introduction to Start Early and for a little bit of context around the national work. We really appreciate it. So I'm going to run through this pretty quickly, but just know that there will be opportunities for you to give feedback. And I'm also going to ask one of my colleagues to please drop in the chat the actual link to the system map as well while I go through it. So feel free to go to that page on your own, bookmark it, and just browse at your own pace as well. So inside the system map, you're going to find several sections. So the community context section outlines Contra Costa's demographics, geography, economic landscape that all shape need and access. It includes data on population, language, race, ethnicity, housing, neighborhood level child density to show where services are most needed. The next section is the healthy beginning section, and that covers prenatal birth and infant health indicators. So think birth outcomes, immunization, screening rates. It highlights where health services are working well and where racial, geographic, or coverage gaps might exist. The next section is the strong supported family section, and that describes family level economic and social determinants and safety net supports that families use. It surfaces stressors that affect parenting and highlights many community assets that we have in the county. The next section is the quality early childhood program section, and it profiles the major early learning and family serving programs that are operating in our county. So think WIC, home visiting, early start, Head Start and early Head Start, state preschool, transitional kindergarten, childcare subsidies. It summarizes things like slots and reach and where capacity might be falling short of estimated need within those programs. The next section is the early childhood workforce section. It represents workforce size, credentials, languages, compensation, turnover risk, and professional development access. It identifies a lot of strengths that we have in our early childhood workforce right now, including a really strong commitment to serving families, as well as some strong bilingual capacity. But it also surfaces barriers like low pay, burnout, and training gaps that might exist. The next section is the funding, governance, and collaboration section, which maps major funding streams, especially public funding streams, as well as major local conveners, governance roles. And finally, there's a program profile appendix section. So this contains really detailed level program tables and data for practitioner and planners who need operational detail to act. So it's standalone program profiles for WIC, for early start, state preschool, TK, et cetera. And early childhood special education, Head Start, home visiting. Lots of those different systems are included in the appendix, which is the program profile section. Okay, so now we're going to turn our attention to the system map itself. So my colleague is going to stop sharing while I start sharing. Give me just one moment here to get this up. So as you can see, this is our First Five website, which is where you'll find the system map. I'm going to move this to full screen just so everyone can see it. Hopefully everyone can see that pretty well. If not, please shout out. So this is the first page of the system map on our website. And across the top, you're going to see the sections that we just discussed earlier. So each of those icons at the top will allow you to navigate directly to the start of that section. So let's click on one just to begin, just as an example. So I'm going to pick the strong supported family section. So now we've jumped straight to that section of the map. A few things I'll point out. On the upper right-hand corner of each page, you'll see a label for the section that you're currently viewing, just in case you get turned around. You'll also notice that each page is numbered down here in the lower right. To navigate further into a section, you can click the arrows down here at the bottom. Forward or backwards allows you to navigate. And if it's in full screen mode, you can also use the arrows on your keyboard. On the upper left of each page, you'll see this icon with 3 lines. Clicking on that icon allows you to navigate to the other major sections of the system map really easily. So if I wanted to go back to the home page, I can click there, and then we can go right back to the strong supported family section. One final way to navigate the system map, if you know which page you're looking for, is to use this progress bar down at the bottom. So if, for example, I know that I want to show everyone here information about caregiver mental health, and I know that that's on page 28, I can navigate using that progress bar down at the bottom. So each of the main sections of the system map is structured in the same way, just for a little bit of continuity. So the section begins with some context setting about which sectors and systems are involved, as well as why this topic is important to understanding early childhood. Next, within the major sections comes the qualitative insight. that we gathered as part of this process. So each of these pages has the major themes that arose across strengths and then opportunities for that topic area. After that, you'll find some aggregated program level data and public data across different subtopics within this larger area. So for each page, you'll often see a mix of quantitative data and qualitative data, as well as a few short sentences on why this topic is important for early childhood system building. So in this section, for example, you can find information on parental employment and income, information on housing, food security, or childcare affordability, just to name a few. So many of the data visualizations within the system map are really interactive on the website. So you can hover, you can segment, you can see details as you interact with the visualization. You can read pop-out details, you can toggle between different views sometimes. So for example, on this page, you'll notice some graphics down here about childcare affordability, benchmarked to 2 different example family income levels. We've set up the visualization to let folks view what this affordability looks like for center-based care or for family childcare homes in our county for these 2 example families. And again, it's just nice to be able to go in and play with the data and see how it interacts. So at the bottom of slides that have quantitative data, you'll notice a hyperlink that will take you to the reference section for that section. So if you just click on this citation down here that says see references, that hyperlink will take you to additional details about where the data comes from, how recently the data was released, and how you can find it for yourself. There are also data points within this tool that are able to be disaggregated by geographic region, like zip code. So for example, if we're staying on the childcare theme here, I know that on page 86, which I'm going to find right now down here at the bottom, you can find data on the physical locations of licensed childcare centers, as well as locations and capacity across different zip codes for family childcare homes. So for example, on this map, you can zoom in, say we wanted to focus in a little bit on licensed center providers in the Antioch, Pittsburgh area. You can zoom in and you can hover over various different locations and see where they are. And then for this visualization over here for family childcare homes, as an example, we know that the data is a bit different. That's available for family childcare homes to protect privacy of providers. And so we're not able to give exact locations of folks' homes, but we are able to see across these different zip codes how many licensed family childcare homes there are within each. And this is a way to get similar information at the aggregate level for the zip codes in our county. And data like this that's sort of geographically disaggregated can help us tell the story about childcare capacity across our county and how it might be changing due to TK enrollment or childcare center closures. Okay, I'm going to stop sharing my screen now. That was a really, really quick overview about how to make your way around the system map, but we really encourage you to go into the tool yourself, play around with it. And another quick reminder, if you have questions, you can please drop them into the Q&A function. And if you have suggestions or ideas, comments, we will be sending a feedback survey to folks that attended the webinar. And that will be a great way to let us know what you think about the system map and any changes that you'd like to see. And with that, I am going to turn it back over to Ruth, who will lead our panel discussion. Ruth?
All right, thank you, Mackenzie. Thank you for that quick navigation of the tool map, and I hope everyone participating today is excited and building the anticipation of actually going in and dive in and playing with the do-yourself. So this morning, we're very thrilled and honored to have a esteemed panel of 2 of our local leaders in our county. And as Mackenzie said, Please don't be shy about adding your questions in the Q&A icon on your screen. I'd like to first present our first panelist, Dr. Francine Jolton is a board-certified pediatrician and graduate of the Chicago Medical School, who recently retired from Contra Costa Health Services after a 32-year career, where she served a consistent clinical role in both the hospital and clinics, as well as numerous committees, positions, most notably chair of the Department of Pediatrics for the last 12 years leading up to retirement. Dr. Jolton was also an active member of our System Map Advisory Group and worked diligently to help us develop the tool. Our second esteemed panelist is Supervisor Chanel Scales Preston. She is a dedicated public servant and current supervisor to District 5 in Contra Costa. Prior to her role as county supervisor, she served on the Pittsburgh City Council and as mayor of Pittsburgh, in addition to several decades serving in federal government agencies. She also serves as the First Five Commissioner, representing the Board of Supervisors in the Commission. Welcome to both of you. So with that, I'd like to get started with the first question. And just to my team, are we going to feature the panelists at this time and maybe take down these? Thank you. Okay, so I'm going to start with the first question, which will go to Dr. Jolton. Dr. Jolton, what was your experience like as part of the advisory group for this project? I would love to hear your insights.
Well, it was an honor to be there, and I was glad that I was able to participate. So many of the organizations that First Five partners with are names often we see as providers on pieces of paper, but not necessarily, get that human contact. And I think that was really helpful for me as a provider and as an advocate for young children to really get a much better overview of who people are that are out there advocating for children on an everyday basis and are so passionate about it. It also, for me, was a wonderful opportunity to advocate just for the health and well-being of young children. I feel like that is our key to success as a county overall, and to be able to particularly advocate for kids that we don't always talk about as much. And the kids are a little bit more hidden behind the scenes if they're either have housing issues and insecurity and don't access care as much. They don't have as much transportation as everybody else, so no one knows exactly where they are. And most importantly, kids that are vulnerable that we do know, the kids that are in child welfare, they're getting moved around lots of time and definitely need our help. And sometimes it's easier not to include them in a project because it's just hard, but this group chose to continue to work with those complicated groups. And then also kids with complex medical needs that often also get a little bit more isolated than everybody else. And I was a privilege to be able to be part of this group and advocate for those kids in particular that we don't always talk about. So.
Thank you. And we were very lucky and honored to have you. I think your voice as a practitioner and boots on the ground, working directly with families and also healthcare providers, brings such a critical insight to the utility of this map and this tool and the data set that we have. So we thank you for your consistent participation, for showing up, for lending your experience, years of experience and insight and understanding of healthcare challenges and needs, and also for your advocacy. So next, I'd like to go to Supervisor Scales Preston for the following question. Supervisor, how does data inform policy, funding, and advocacy decisions in your work day to day? And what types of data do you rely on the most?
Thank you. First, I just want to thank First Five and just for looking into this and doing this work. This data is really important because numbers is what drive the funding. It's important to have good data just to understand the specific program gaps that we have in our county. I serve a community that is underserved, underrepresented, here in District 5. And so just going over the map and seeing Pittsburgh there is one of the communities where, you know, we need more services there, more need there in Pittsburgh and Antioch. And so that data helps show us the disparities throughout the county. So not just in District 5, as well as West Contra Costa County. And then it shows us the deep inequities that we have, where we all need to figure out how do we come together. And then we all can be working from the same shared data. I think if we're able to do that, then we can truly represent, our county as a whole by viewing this data.
Thank you, Supervisor. And indeed, actually, that is one of our main goals, to be able to have a shared space and tool where we can all have access to relevant data. And for you as a decision maker, I appreciate you highlighting the importance of having access to critical data that can help you not only understand the depth and breadth of needs and challenges in the county, but also help you assist, with the decision making. So thank you for that insight. Dr. Jolton, I also would love to pose the same question to you from a different lens. I'd love to hear from your lens as a health practitioner over your career and your experience with our county system. How have you used data to do the work that you've done in your trajectory?
Yeah, I think as busy providers in the county, and as you know, it's not an easy job. Every day you get really focused sometimes on the little piece of the puzzle that you fill, which may be coming to clinic that day or covering a shift up in labor and delivery with taking care of the newborns or whatever it is, and you lose sight sometimes of what everybody else is doing across the system. And you go to advocate for something, you see my patients that I'm seeing aren't getting X, Y, or Z, but then you realize that's just a small piece of what everyone is trying to grapple with. So I feel like having data helps broaden our lens of how we look at each of our own individual problems or passions, right? No one's is better than the other, but it all has to be put in a big bucket, right? And then decide how do we get it to land. And I'm sure the supervisor knows there's unfortunately not endless funding for all of these things, and I'm sure they would love to fund everything that people come to them with, but they can't, right? So how do you learn about what everybody else is doing, and how you can partner with people to say, wait, we do have common goals here. We're seeing, maybe from a different angle, but we're seeing the similar effects of decrease in funding or not having services here. Or I also think bringing in the disparities is really important. As healthcare providers, I think healthcare providers are getting trained much more about disparities now, but as in my introduction, I am now recently retired, so I'm on the older trained side, and no one talked about health disparities with us, when I was in training. And so that's, an area where I have learned and grown so much in my own personal career. And I feel like data helps tell that story. It just takes away, it's not, it just removes the bias. And I think it's so important that people see the disparities and speak from data and not just from passion. So, yeah.
Thank you. I think we may have just lost Ruth, but that's okay. I'm just going to step in and continue to ask these questions. I love that response from both of you. Oh, hi. There you are, Ruth.
I'm sorry. We are just pivoting because I had some technical difficulties, but I wanted to continue. And I want to thank you, Dr. Jolton, for that insight. I think both of you have really elevated the importance of not only quantitative data, but also qualitative data for just helping us as practitioners and as leaders in the community make critical prioritization and coordination of resources and services. And one thing that I'm constantly also hear from other partners in our county is that while data is so critical, the realities are like our reality is multidimensional, right? And so not one number can tell a true story to its totality. And so having access to multiple sets of data, numbers, statistics, and also anecdotal data like the one we can find in a map is so critical to get a more thorough understanding of the realities and what we're dealing and getting a true story for what we're working with. So thank you both. So I want to continue with our last sort of question for the panel, and I'll start with Dr. Jolton. Where do you see the biggest opportunity for improving access to services or supports for young children in our county?
This is in this day and age, this is a tough question, right? Because we all want more opportunities, and unfortunately, we keep feeling the sense of less opportunity, right? There are budget cuts and things happening at the federal level that are, I will say, disheartening is probably the nicest word I could choose right now for all of that. And it's hard. And I really, I couldn't imagine what the supervisor has to do every day and decisions they have to make. And I feel like, it is tough. And I am concerned, and I'm not really sure where the opportunity, I mean, in that sense, I would say I'm not sure, because I'm so concerned about when I heard recently about the large number of public health nurses that received layoff notices in our county. And that's a group of people that I've worked with my entire career. And it's the work, it wasn't the sexy work, right? It's not like we can say, oh, look at the thousands of, families that one nurse served, because it's not like that. Because you go into a home and you find one person with one need, and then you realize that the whole family has needs, and all of a sudden it becomes, a lot of work for a very small number of people. But that difference is immeasurable. Like, that can't be captured necessarily, right? And you just don't want to hear these stories of services being lost that I just do feel are so critical. So I sort of feel like the opportunity really is for us to pick those priorities. Like, where are the priorities? So our partners, we're not all clamoring for many different things and at the end wind up with nothing. Like, do we start speaking together in a more uniformed voice to say, these are the critical things that things we see as most critical based on this type of data and discussions we're having, and particularly with the focus groups and what our families are telling us, and knowing we can't do it all, how do we start to do it, and preserve what we can preserve or grow where we can grow, and realize we may lose some things, which nobody wants. It's not because it's not important, but it's like there's not endless funding and endless services and endless employment. And so that's one piece. And I think the other piece for you too is just some way using this to make sure that there's reliable information for everybody, right? That we know this is a reliable source, not just for us, but also for the families we serve. Because the other concern is the lack of trust in the community right now. And so how do we use this type of partnership and data and access to information to make sure our families feel safe, that they feel that vaccines are safe, that getting preventative care is good, that, going to WIC and getting your nutritional needs met is a good thing. It's not a risk to go there, then, with immigration problems, how do we make sure people know the way to do things and do it safely, and that this group can help build that trust, I would say, for the good information.
Thank you for that, Dr. Jolton. Supervisor Scales-Preston, I'd like to pose the same question to you as well. Where do you see the biggest opportunity for improving access to services or supports for young children in our county?
Thank you. First, I just want to touch on what Dr. Jolton just shared in terms of funding. And it can just be like depressing sometimes with everything that's going on the federal level and how those cuts are trickling down here in our county and how they're playing out right now today. People, community needs these services, right? And so being a new supervisor, I really try hard to sit around my community's voices and needs. And that's just because I'm born and raised here in the city of Pittsburgh, and I was that kid growing up, and so I understand that we need leaders to focus on those things too, because they matter just to regular everyday people. People here in my district where healthcare is so expensive and they're working multiple jobs or non-traditional hours. When we talk about disparities, Dr. Jolton. I'm just thinking about District 5 of Lone, where I have 3 refineries. I have Highway 4, that's like the heaviest traffic here in Contra Costa County. I have a landfill and multiple, industry companies. And, when you think about disparities there, is huge, right? And those disparities play out where in our healthcare system, as you were sharing, when you go to someone's home, it's just not one thing, you find multiple things because that's the community we live in. So we need all of that help and services. And so at a time like this right now, I think, having data is what helps us understand where those funds need to go, where it's most important to go to those communities that needs need to be met right away. And then when you don't have the funding to help serve that, it's also looking at like First Five and other community-based organizations and nonprofits and how we come together to help take care of these needs and working, from whether it's government level, county, city is, and our nonprofits, really building a base of we got to take care of Contra Costa and the community here.
Thank you, supervisors. Thank you to both of you. A couple of really salient points, multiple that you named, but one that really stands out for me is that, yes, right now we are living in very difficult times, making very difficult decisions, and our ability to be able to rely on shared information and understanding of what we're looking at together as a community it's so critical right now, right? And so I know that as a county, we're making a lot of efforts to make civic engagement a lot more dynamic and active. And I believe that using the data can be dynamic too, because it can really lead to, that conversation of dialogue because we're also busy in our own area of focus, in our own day-to-day work. And it is a challenge, whatever role we have, whether, you're doing direct service or not, it is very difficult to constantly look at the totality of the problem. So for me, I do hear also a line of hope in that, and that's one intention with this system map, that it is a tool that is centralized that we can improve and that we can use to continue to make sense and understand the issues that we have and that our families are facing. You also both spoke about the importance of having a united voice to support our joint efforts, right? So I know in early childhood, we always say it takes a village to raise a child. Well, it definitely takes a collective village to problem solve and to bring all of our assets forward and be creative. So I just want to thank you both for your leadership and what you do every day in your distinct roles. And, we look forward to continue to partner with you as we continue to meet the needs that families have in Contra Costa. So we'll now move on to Q&A. I think someone in the team is tracking that. But for that, I will turn it over to Mackenzie, who can tell us if there are any questions. Mackenzie?
Yes, we have just a couple
For our
questions.
panelists. Yeah.
But if folks want to continue, any participants can continue to drop any questions that you have about the system map itself, or any questions that you have for our panelists or our speaker from Start Early. Now would be the time to do that. So one question that we do have in the Q&A is, who is the intended audience for this system map? And I am going to pose that first to Ruth, and then I can ask Jess to also weigh in from Start Early. And then, of course, if our panelists would also like to speak up, I'm happy to hear from them as well. But Ruth, who's the audience for this tool, this product?
Yes, that's a great question. So I think our intended audience is all of us in in different sectors working for families and young children. We did not create the system map thinking about families necessarily, because they already have a hard time, they have enough to worry about and understanding, although there's great information there, and families and providers were part of the advisory group. But really our intent here is to provide access to information to those of us making decisions about the programs, the services that families need, where collaborations need to be made, where funding need to be, brought in, what opportunities are there. So we were thinking about not only the service provider group in the different sectors, but also our elected officials, our funding partners. I think that a lot of as we are trying to face the critical times that we were talking about earlier, having access to quick information and data that can be turned in to a proposal or, a hearing, even at the state, right, to kind of elevate the need. I think that's the kind of utility that we're looking at. So the groups are really our funders, our service providers, our elected officials, and our advocates working on behalf of families and young children.
Thank you, Ruth. And Jess, I'm not sure if you have anything you'd like to add about, I know you've worked on these types of product build outs and system mapping, system building efforts across many different communities across the US. So if you have anything to add about who else could use this product or this tool, we'd be open to hearing that.
Yeah, I think everything Ruth said, and we also really think of the systems map as a conversation starter too, right? A baseline, a foundation for this is the first inquiry. How do we continue the conversations, or where does it point to possibly conversations or further investigation or digging, that things that we want to think about. So we think about it as sort of what's our first glance at what a comprehensive system is across the county, and then think about it as how do you go further than that? What's the initial story, and then how do you dive further into it? So I think that maybe doesn't answer quite the audience question, but or in terms of how we would use it, and it's for whoever wants to continue to investigate and look and think and about these early childhood systems. That's who it's for.
Thank you, Jess. Yes, we are. This is the community's tool. This is not First Five's tool. This belongs to everyone in Contra Costa. So thank you very much for being able to point that out, Jess. We had another sort of small logisticy type question pop up in the Q&A, and that is, who will be updating the map and how often will it be updated? And so First Five, in partnership with Start Early, was the one who built this map. We had so much effort and help and man hours across the county and across programs to be able to collect data, help us recruit participants for qualitative inquiry that filled in parts of these that we didn't have hard data for. And so this is a collective effort, but First Five is committed to updating the system map every 2 years on our website. So this particular map functions as sort of the end of 2025's data point. And then the end of 2027 is when you can expect an updated system map to come out from First Five. And I'm sure we'll have more events like this to be able to launch the next version as well. So hopefully that answers folks' questions. There's not too many other questions in the Q&A right now, but I was curious from our panelists if folks can take a moment to put themselves 10 years in the future and imagine a Contra Costa County where every child is supported, every child 0 to 5 is thriving, all their families are well supported, and it's an early childhood ecosystem that is working really, really well. What had to happen in that 10 years, and how did we get there? What is like one policy or funding lever that was pulled, or a number of different policy levers or funding levers that were pulled, or anything that you can imagine to get us to that wonderfully functioning system? And what did it take to get there? I know that's kind of a complicated question, but I would love to hear if anybody has thoughts about that imagined ideal future that I think we're all, aiming to get to together. So I'm just going to assign someone. So I'm not sure if Supervisor Scales Preston, you just hopped off mute.
I'll just go for it. So I think the perfect thing would be is, having funding. I mean, that's what it really boils down to, and making sure that we have, um, different service providers to be in these spaces to meet the community needs as well. And so 10 years from now, if it was up to me, it would be advocating those 10 years to figure out how we get leaders to see that, supporting a child from 0 to 5 means a lot. Making sure that they're able to read at a third grade level. Once they hit the third grade, those are some of the disparities in my community where they're in junior high and high school and they're still reading at a grade school, a lower grade school level, which is just unfortunate. And so if we know if a child is able to succeed early on, if we are able to provide those resources early on, they'll be just rock stars, right? And so I think we live in a great community where we do have nonprofits and community-based organizations that do work together a lot. They just need more funding to be able to execute those things. And so advocating, getting our lawmakers to see how important it is, getting them out in the community so they could be on the ground and see how important it is. I think those stories mean a lot, whether they're in Sacramento or in Washington, D.C., and whether they're going to visit, early childhood centers anywhere across the United States, right? It means a lot. And so it has to be a focus from the top as well.
I appreciate that insight, Supervisor. Thank you. Dr. Dalton, I'm not sure if you have something to add about an imagined future.
Yeah, because I may have grandchildren then, who knows? Anyway, but I agree with everything that's been said. It's such a beautiful thing to imagine because it's really not just bringing the services to the children and families who need it, but it's also supporting the people that do the work, right? So to be a childcare provider or to be a teacher should be a well-valued career choice that is paid a living wage and gets healthcare benefits and doesn't force you to work 3 of those jobs in order to, right? So to me, it's like, how do we make it just much more healthy community? Because if we do that, our children will thrive, and using children as the first goal is always a good one, right? No, nobody said, oh, no, I want to not fund things for children, right? That doesn't usually go very well. But it's all the pieces that lie underneath of it, right? How do we recruit doctors to come work in the Antioch Health Center, right? And keep it so they can commute there reasonably and be able to, hopefully they speak the same language as patients that they're seeing and those kinds of things. And that's a whole different process than it is maybe to get a physician to go work at some high level, research-based institution. It's just they're different kinds of doctors and they're both needed, but we need to figure out how do we do that piece, right? But it's the same, particularly though, passionate about the teachers and the childcare providers and families having living wages. And so it's like all those pieces have to really be advocated for. I'd like to think maybe we can do some of that work before the next 3 years is up, and our leadership structure, hopefully at the federal level, starts to really change in the lens of how we look at our country and the morality that we look at what we do and the decisions that are made will start to, hopefully the ship will turn and we can get back to something that makes us feel good about waking up every day and doing our jobs. Yeah. So I think.
Thank you, Dr. Dalton. There's certainly a lot of work ahead of us and now and 10 years in the future even. I'm sure there will be additional things that we need to do, but it was really great to hear from both of you, your insights there. So we don't have any other questions in the chat. But another thing that I was curious, and I would love to pass this over to Ruth if that's okay, and then if other folks would like to join in. I heard both of our panelists speak really strongly about marginalized communities in our county and the disparities that exist in opportunity and outcome for children across different areas, different socioeconomic statuses, what have you. What do you think of the phrase, "there is no such thing as other people's children"? The collective responsibility that we all have in our county to care for all of our county children. I'm curious if you have any insights that you wanted to share that speak to that at all, and how we can broaden that message and broaden the tent, bring people in under that.
Yes, thank you, Mackenzie. And I'm very inspired by Dr. Jolton's and Supervisor Scales-Preston's vision, and I definitely share with them, I ditto their vision. Absolutely, I believe that children are our collective responsibility. They are our future generation. They are the future doctors and teachers. And oftentimes, the reason why we at First Five are so proud of our work, and one role that we have is to be one key broadcaster of the importance of investing early and investing in the early years. It's because our babies cannot do the hard work of advocacy. They cannot go to public comment. They cannot do all of that. They really depend on us to look after them and to recognize that the money we invest early will save us millions of dollars in totality for the entire society in the future. So I think there's enough, data around that in the last, certainly over my career, but in the last 40 decades. So I would say that reframing, not about like the question of like whose children are these, but children are a population of our entire society that is the future, that is the tomorrow. And they really rely on all of us to do that. And it takes that foresight and prioritizing, recognizing that investing early is at the heart of prevention for any country. So I'll stop there because I know we have a few minutes left. I don't know if you want me to segue into.
Yeah, no, thank you so much for answering the questions, and this question and answer session was really wonderful for everyone to be able to see. So I'm going to pass it over to Ruth and get going on some of our closing statements. I think we'll pull up our slides as well. And
yeah,
there we go.
Thank you, Mackenzie. I love this, the last two questions, very inspirational. So I again thank you to our participants for your questions as well and your wonderings. And at First Five, we're really excited about the possibilities of this new system map. And as I said earlier, it's great that we have this shared tool that, as Mackenzie mentioned, we really view it not as something that belongs to First Five, but something that belongs to Contra Costa County and all of us working on behalf of young children and families. And so we really depend on all of you to engage with the data and to, be curious and reach out. We want to keep this momentum going. So it's about the learning and about the conversations that will follow that we're really excited about. As Mackenzie also mentioned earlier, our plan is to update the system map every other year with ongoing input from all of your organizations. One thing I'll say is, by no means do we want to say that the system map is like 100% full and that it has complete, right? Or that it has everything or that is perfect. But it is an exciting starting point for a shared data, repository where we can all make better as we begin engaging with the data and have conversations about what needs to change, what needs to be added, how do we tell stories in a more comprehensive way. So again, we will continue to explore what new data can be added to the map in the next couple of years until we're ready to update it. And we think of this as holding ourselves accountable to improving the system map, but as a tool that will help us also improve our systems and what we're doing on behalf of our youngest residents. So, our systems are very complex and multifaceted. There's a lot of layers and data in the map, as you saw. And as we're wrapping up the webinar today, I wanted to just highlight some of our own insights from a First Five lens. So I'll have one of my colleagues, oh, it's already there, it's the right slide. Okay, so I wanted to share some just very high level first insights from First Five Contra Costa about the system map. The first one is that families with young children are navigating intense complexity in our current systems. Accessing services and getting connected to the right programs takes persistence, and it shouldn't be a matter of luck, but it feels like that. That's what we hear from families. Families need more support connecting to services, particularly preventive services that could help them avoid a crisis. The second insight is that early and ongoing developmental screening is critical to meeting the needs of children 0 to 5. And so through early identification, children are more likely to receive targeted preventive services that can mitigate the impact of developmental delays and disabilities. And while screening rates in Contra Costa County have been improving, we are not where we need to be as a county. And then thirdly, equitable access to high-quality, affordable childcare is a foundational need for thriving children, families, and communities. Supporting and retaining a skilled early care and education workforce that provides inclusive and culturally affirming education is critical for economic and family stability. And lastly, relationships are the foundation of strong systems. We have heard that through our advisory group participants, and we hear it all the time in other tables. Trusting, positive relationships with families are essential for a system to function effectively. And cultural competence and respect must be at the core of those interactions. Equally important are the relationships among system leaders, right? All of us at this level, at the level of the practitioner and the system leaders, trust and transparency are really essential. It's simply not an option. They are fundamental principles to building a cohesive, responsive early childhood system. We have a tool, a summary of some of our preliminary insights that I know we will be sharing in the chat with all of you. Next slide. Before we depart, I just want to extend our huge appreciation and gratitude to all of our local partners, practitioners, parents, and providers who contributed to the design of the system map. We thank you for lending your voice and your expertise and your knowledge of the system. We hope you're curious, all of you who are here today, about how you can use this tool and all that it contains. We hope that you're motivated to share it with your colleagues, your teams, and any other coalition that you're a part of. And we really encourage you to engage in conversation and dialogue so that we build that shared understanding. Above all, we hope that a shared understanding for all of us ignites collective action across your spheres of influence. Each of us has a different sphere of influence. So, as I said earlier, our youngest children are relying on us as system leaders to shape communities that nurture families, strengthen opportunity, and allow every child to flourish. So we want to thank you for joining us in this effort. Please reach out to us if you have questions and let us know. We want to hear how you're using the tool and how we can improve it. So with that, I will turn it back to Mackenzie, who will wrap up the webinar.
Thank you
Thanks,
so much
everyone.
for that wonderful wrap up, Ruth. We really appreciate it. And thank you again to all of our panelists and our speakers and everyone who attended the webinar today. Watch for that follow-up email with more recordings, slides, and more resources. Have a great day. We look forward to hearing from you.